Good evening and welcome to Vision Talk on the second Monday of the month. Every month at this time, 6:15, we do our chat with the good folks from the wonderful entity that is Vision Bermuda. We've got Theresa McMordie, who heads up, and we also have local practicing ophthalmologist, Dr. Jake Smith. And welcome to the program this evening, guys. We'd like to thank you so much for taking a little time out for us this evening. How are you doing?
Great, thanks.
Hi.
Yeah, lovely to be here.
Yeah, so we've had a bit of a chat before we go on air this evening, and just talking about Vision Talk, Theresa and Dr. Smith, and what has your relationship been like with the society that helps those with sight problems here?
Very good. I mean, I've been working with Vision Bermuda for many years now, and they certainly provide a much needed service to patients from all varieties. They've always had a vision rehab officer, and that's really the key service that I engage with.
Mm-hmm. Mm-hmm. And that's what Theresa does. So at present, Theresa, we know that things are ticking along as far as getting the center up and running again at Beacon House. But how's that going as far as the services you guys are providing right now?
Well, at the moment, I'm going into people's homes to do assessments,
Mm-hmm.
which has its place as well, because when you're in somebody's home, they're much more relaxed, or
Mm-hmm.
can be, and you can see, you have an idea of what, might help support them as well.
Mm-hmm. That's
Yeah.
good. That's good. So, Dr. Smith, there are many things that can cause vision difficulties here on the island, and I guess we'll just jump right in. And once again, thank you for the great work that you do here, because oftentimes, you have to, take over a crisis situation where folks have gotten to a point in whatever their eye disease is, and, try and make it right again. And I know that there have been wonderful, wonderful advances as far as things like, the ability to have tools and skills to help folks with things like diabetic retinopathy and glaucoma and macular degeneration, which are sort of three of the biggies here on the island, right, as far as causing sight loss here. So thank you for that. And I guess we want to talk about, prevention maybe, but also you could maybe talk on a little bit more of a medical level about what some of the things that can be done to fix these situations.
Yeah. So diabetes and glaucoma, as you correctly say, are probably the two biggest causes of vision loss in Bermuda.
Mm-hmm.
Both of which can be prevented much more easily than they can be treated.
Sure.
Diabetes, everyone with diabetes should be seen by an eye care provider annually. That's the sort of rule of thumb.
Mm-hmm.
Diabetes can affect the eye in a number of different ways. You can get diabetic retinopathy, which is what everyone thinks of when they think of diabetes, and bleeds inside the eye from the diabetic retinopathy. Diabetic maculopathy affects the central vision and
Mm-hmm.
is actually commoner.
Mm-hmm.
And finally, diabetes puts your risk of developing both cataract and glaucoma at a higher rate than the
Mm-hmm.
background population. So those are two things that we actually end up treating a lot more frequently in people with diabetes than
Mm-hmm.
in everyone else.
Could you just explain, perhaps, a short version of what actually happens, those with diabetes, what it does to the retina, and as far as that sort of snowballs into the other ones?
Well, first of all, let's start talking about what the retina is.
Sure, it's an amazing thing.
It
I
is.
know that much.
It is. If you think about the eye as like a camera,
Mm-hmm.
there's a lens at the front of the eye that focuses the picture onto the sensor in your camera.
Sure.
And the equivalent of that sensor in the eye is the retina. It's the bit that turns the light signals into electrical signals that go back to the brain.
Mm-hmm.
So it's really the crucial part that does the sort of seeing in the eye. It sits at the back of the eye, and so it's difficult to access. With diabetes, it's got a crucial blood supply that can be compromised in diabetes.
And that is due to some inflammation of the
it's
blood flow?
Due partly to the fact that blood that's full of sugar is more viscous. It's gloopy. It's like syrup, and that impedes its flow through the very small blood vessels that get to the retina.
And therefore it starts to cause damage, yes?
Yeah, so an interesting fact about the retina is that it's the most oxygen-demanding tissue in the body per gram. It's not very many grams,
sure,
but it gets through an awful lot of oxygen for what it is. So it needs very intense blood supply.
Yes.
And that comes from both behind the retina and in front of the retina. The problem with supplying the retina with blood from the front side is blood's opaque, and it gets in the way of the light that's getting to the retina. If the retina is short of blood supply, it releases a hormone which encourages the blood vessels of the layer to expand, but it also encourages them to leak, and it encourages new blood vessels to grow.
Okay.
All that sounds good. Sounds like you might get more blood supply to the retina, but comes with problems.
Sure.
New blood vessels that grow are very fragile and can break and bleed. And then the eye fills with blood, and an eye that's full of blood is can't see.
Can't see anything, yes.
So that's diabetic retinopathy, and that's sort of what occurs in diabetic retinopathy. Diabetic maculopathy is when the blood vessels get the same hormone that encourages new blood vessels to grow, but it also encourages them to leak. And that leaky fluid, that straw-coloured fluid, if you've ever grazed your skin,
sure,
you get that straw-coloured liquid that comes out of blood. That's that serum that's coming out into the retina.
Again.
And that distorts vision. It's fluid within the retina, makes the retina no longer flat, and so you get waviness and loss of vision through that maculopathy. There's a hormone that causes all of that, which was the big discovery really since I've been in ophthalmology, called vasoendothelial growth factor, or VEGF.
VEGF, okay.
And there's been a series of medications that can be injected into the eye that mop up that hormone and prevent the new blood vessels from growing, but they also allow the fluid that's leaked out of blood vessels to be reabsorbed.
Gotcha. Okay.
And
that's a big advance.
It's a huge advance. I think they came when I was had just started in ophthalmology when I finished my training anyway in 2008, 2009. They first started coming in. They were originally introduced for macular degeneration, but then discovered to be very effective in diabetic maculopathy, and more recently in diabetic retinopathy as well.
That's awesome. So the advances in the science are in our favour.
Not just the science, but
to
actually
a degree,
the practicalities of the treatment as well.
How to use it, and of course that's to be applauded.
There's always a gap between the science and what we can actually achieve and do with it, and practically deliver.
But I know that you wanted to talk about the prevention as opposed to that having, it's wonderful that we have these options now. But prevention is something, I think we should touch on briefly, and then we'll talk about, a couple of the other ones that we've mentioned as well.
So everyone with diabetes should have somebody look at their retina every year. The reason for that is that if we can see these new blood vessels growing before they've broken, before they've bled, before they've become a problem, and we can treat them either with those injections or with laser treatment.
Okay.
And prevention is much better than cure.
Than trying to fix it, So most people are familiar with the term glaucoma, and it being, of course, associated as an eye disease, but being diabetic increases the chances of you developing that as well.
It does. Glaucoma is a bit of a mystery to many people, and I think I ought to describe a little bit about what it is and what
it isn't, probably, as well.
And how we can prevent it. Glaucoma is a disease of the optic nerve, the nerve that carries all the information from the eye to the brain.
To the brain.
When that nerve doesn't have enough capacity to carry all the information that the eye produces, the peripheral vision is sacrificed first, because clearly the central vision is what's been most important to our survival.
Evolution has proven, yes.
Yes, evolution has proven. And so we lose the peripheral vision first. And just as you don't notice particularly that you can't see behind you because you're used to it. It's the way it's always been. You don't notice when you lose your peripheral vision. And so people will only present if they haven't been found at routine screening. People only present to an eye doctor when most of their peripheral vision has already gone. The real problem with glaucoma is that vision that you've lost can never be returned.
We can't get it back, guys. That's a one-way street.
The best we can hope for in glaucoma is to stop it from getting
To arrest
any
it.
worse.
Yeah,
arrest it.
Exactly. And what are the general treatments for that?
So there's 3 treatments for glaucoma. There's drops to reduce the pressure. All the treatments are focused at reducing the pressure in the eye.
Sure.
The problem with drops is you need to take them every day for the rest of your days. And that's quite a burden, actually.
It can be, yeah.
It can be.
It can be.
And there's a series of different drops, and some of them have certain side effects and others have different side effects, and it's a
Gotcha.
matter of finding the right drop that suits you. The second treatment is laser. Laser called selective laser trabeculoplasty, which is a mouthful. We just
Yes,
call
it
it SLT. SLT laser. And that's great. It's a very effective treatment. It's at least as effective as drops, and the advantage of it is that it's one-off. You do it once and it lasts at least a year, sometimes 2 years, and occasionally even 3 years, and it can be repeated.
Gotcha. Okay.
So that sort of takes away the burden of some of the drops.
How invasive is that, if I might ask?
It's not very invasive. It sounds, laser people get a little nervous about, but it literally takes 5 minutes to do.
Wow.
It's done in the office. It causes a little bit of inflammation in the eye afterwards, so I give people a week's worth of drops following the laser.
Sure.
But most people do very well.
Wow. Good to know.
Yeah.
Don't be afraid, guys.
Exactly. And there was just to give you an idea of how safe it is and the rate of side effects. There was a study comparing laser versus drops, and people for some reason are much less scared of drops than they are of laser. And actually, the side effect profile of laser was better than drops.
There you go. So it's all about the knowledge and how it's presented sometimes, I'm sure. So, basically we're saying here, your GP, you want to see them once a year anyway for an annual. And then is it sort of common for a GP to say, okay, you need to see the eye doctor too after a certain age? Is there some sort of advice we should give on, because you have to be your own best advocate when you're seeing your doctor. I'm a big champion of that. Ask for what you want to know. And if someone can't tell you, then you ask someone else, So where is that as far as, the first best practice to keep people, on I guess to encourage them is hard to get people to, say, well, let me make that date again, and I'm not going to see my doctor till I'm sick or something. But this could be the difference between, losing your sight totally or not. So
I think if you've got diabetes, you should be seeing an eye care provider of some kind, either an optometrist or an ophthalmologist every year. That really is the important message about diabetes.
Sure.
That just as you get your feet checked, and you should get your feet checked if you have diabetes, you should get your eyes checked as well.
Absolutely, yeah, absolutely, and that's good to know. There are some reluctant patients out there, I'm sure. So we want to encourage them that all of this is doable, I guess, is a good way to put it. We want to take the fear out of these choices for people if we can. And you mentioned also macular degeneration, which again causes a slightly different type of vision loss, but that's progressive as well.
Yeah, so macular degeneration, sometimes called age-related macular degeneration, happens by kind of its name to older people, and it causes damage to the central vision. The kind of good thing, I suppose, about macular degeneration is that people notice it, and people notice it early on. That's the good side, is that people with macular degeneration generally come and see you.
And what are sort of the warning signs with vision?
So straight lines no longer appear straight in the central vision. So people will look at a door frame, for example, or a window frame, and close one eye and go, "That's got a little kink in it. That's not, that door frame isn't straight." That's the very earliest sign.
Okay.
If that's ignored for a while, then the central vision just gets worse and worse.
And is it about it just becoming wavy or out of focus or dark spots? Because you hear people talk about having floaters in their vision, field of vision and stuff. So
yeah, so I have to backtrack a little bit. I'm talking about wet macular degeneration.
Okay.
Macular degeneration gets split into wet and dry.
Okay.
Dry macular degeneration causes slow, gradual decrease of the central vision. Wet macular degeneration is the sort that causes the waviness of straight lines.
Gotcha. Okay.
There's not a great deal we can do to treat dry macular degeneration. It's one of the more frustrating things. What we can do is stop it from turning into wet macular degeneration. The good thing about dry macular degeneration is that it's very slowly progressive.
Gotcha.
And very few people would be blind from dry macular degeneration alone.
Okay.
The bad thing about dry macular degeneration is that it can convert
Sure.
into wet macular degeneration, which does make your vision worse quite quickly.
Yeah,
within
eventually.
weeks to months.
Gotcha. Okay.
Quite quickly.
Mm-hmm.
And I can remember in the days before these injections, when I'd see people with wet macular degeneration and have to tell them that the future was not looking good.
Mm-hmm.
That has changed. It really has changed radically. And the injections have made the prospects, the future for such patients much brighter.
Gotcha. Now, and again, that is the macular degeneration is exacerbated if you're diabetic, or it comes with old age. You said for some anyway.
There's a number of risk factors for macular degeneration. One of the things I should say is smoking.
Gotcha.
Is the number one risk factor really that's modifiable that we can do something about. The number one risk factor is of course your genes, but there's not a lot we can do about that.
Yeah, you can't change your genes. Can't pick your parents.
But the number one modifiable risk factor is smoking. There was a controversial big study years ago called the age-related eye disease study, which looked at a series of multivitamins, which suggested that in a small group of patients with dry macular degeneration, taking some supplements might be worthwhile to reduce the rate of conversion from dry to wet macular degeneration.
Okay, and there are certain things, nutrients that are good for eye health, and perhaps we could touch on them in a minute. And Theresa and I had quite a chat about cataracts, which was sort of the last sort of prevalent cause of sight loss in Bermuda that we were talking about, and how some can be more complicated than others. I know there have been huge advances in treating cataracts. I've been privileged to sit in some doctors' meetings and see some of that stuff going on, with new technology again and various other things. So, some people are getting cataracts done here, some people aren't, and there are reasons why. Just trying to get theater time, I know, is a big one now, but that's the thing that's talked about the most here, as far as causing sight loss.
It's really, I love cataract and cataract surgery because it's such a satisfying procedure to do for most patients. I have to say it was a big part of my motivation for getting into ophthalmology in the first place. To specialise like you did. We get to play with some fun pieces of equipment.
I've seen them, like I said. It's pretty radical, but mind-blowing to say the least. What can be done?
It's a great operation, and for the vast majority of patients, there's a wow factor to cataract, and they definitely see better afterwards than before. It's the commonest operation in the world, and it's the commonest operation. There's no other operation that's done more worldwide than cataracts.
Than cataract surgery, wow.
If you live long enough, you're going to get cataracts.
Something to look forward to.
And so ultimately we all need it.
Yeah. And so just explain a little bit about what causes them, I guess, then, and what we can do to perhaps slow that result.
So we're all born with a lens inside the eye, and that lens needs to be clear, needs to be transparent in order for us to see well. And as we get older, that lens continues to grow. The lens material is like hair or nail. It's sort of dead material that you can't stop it from growing, just as you can't stop your hair or your nails from growing. And because it continues to grow, it packs down tighter as you get older. When you get into your late 40s or 50s, you no longer have the ability to focus on near objects, and you need glasses. You need reading glasses. When you get into your late 60s and 70s, most people, that lens starts to lose its nice crystalline transparency.
Sure.
And the only way we know of correcting that once it's lost its transparency is through surgery. As you correctly pointed out, there have been lots and lots of studies to try and prevent cataract from forming in the first place. And indeed, that age-related eye disease study, the ARID study that I kind of referred to earlier about macular degeneration, wasn't focused on macular degeneration originally. It was a study to try and find a way to prevent cataracts from forming. Unfortunately, other than surgery, no treatment's been found that actually slows cataracts. So really, surgery's the only option.
But the good news is how advanced it is now, and how successful it 9.9 times out of 10 it is.
Yep, that's about the right number, actually. 9.9 times out of 10 is about right.
Sure. Yeah. And all of this, it goes without saying, doctor, that lifestyle, metabolic diseases here, that diabetes being the one we're focusing on, but all the other things that come along with it too, whether you have hypertension or whether you have cholesterol issues, all of those things can be, make your life pretty tough, but also going to your eye doctor could enable you to, eye doctors can see little things going wrong way before they've affected other major organs in the body because of the marvelous retina that you spoke about. So knowing that...
I realized I just misspoke about one of the things about cataract. There's nothing we can do to prevent cataract in those who are doing everything they can as far as controlling your diabetes is concerned. We know that diabetes causes cataract, just as we know that smoking causes cataract.
Got you. So there are
those metabolic diseases that you just mentioned do make cataract happen at a younger age than it would otherwise.
It sort of speeds up the process a little bit. And again, it's about inflammation in the body at the end of the day with just about all of those we're talking about. So I think we have a couple minutes maybe to just speak about prevention. And I suppose as a man in the medical profession, you would talk a little bit about, nutrition, exercise, protection, maybe because we live in such a sunny climate, and of course, protecting your eyes from UV rays and things like that.
Yes. So there's a number of other things on that list that can affect your eyes. Well, pterygium and ocular surface disease and cataracts are all made worse by ultraviolet light, by sunshine.
Gotcha.
And particularly when people are out on the water. The UV on the water is particularly intense. Wearing sunglasses when you're out on the water is
highly
crucial.
Recommended.
Yeah, crucial.
Highly recommended. Crucial, the man said, folks.
But any time when you're out in the sunshine, really.
Sure. Yeah, and people ride bikes, myself included here, and lots of times we'll have a visor, but our protection, is essential. It should be for you when I see people squinting and in the rain and trying to cover your eyes, do yourself a favor, yeah?
The visor's good at protecting from UV, but also flying objects.
Flying objects too, yes.
It's really the...
Injury to the eye can cause vision loss, yes, that's another one. But all jokes aside, we wanted to have you here today, and Theresa and I spoke about it because we want our listeners out there to know that there's a lot you can do, to make... whatever path you're on not be so scary. So there's a lot to think about, and also the fact that Vision Bermuda can be such a good asset for when you're dealing with, if you've had these type of diagnoses and what you're dealing with. So Theresa, if you could just talk really briefly about I know you mentioned a little bit about what you're doing and where you are as far as your services you are and the rest of the staff doing in-home work and stuff. But your contact information, if people have any questions about today's show or anything, how we can get them the information they need.
Yes, thank you. If anybody's listening to this, or of a family member or a friend who eyesight isn't perhaps as clear as it could be, and it can't be corrected by glasses, then please get in touch with us, because there may be something that we can do. We may be able to help you in some way if you need to see an ophthalmologist.
To expedite treatment or so on, yes.
Yeah, so I'd come along and do an assessment, and then we can take it further from there. I see so many clients who didn't listen to their own intuition and didn't go and have a checkup for one reason and another and left it a bit late. And all I ask is that if you're one of these and you want to talk to somebody about it first, then please do get in touch with me. The main number is 292-3231. And the lovely Phyllis will answer the phone.
She will. I spoke to her the other day.
Yeah, and she will pass the message on to me. And, once we get up and going with Beacon House, which hopefully won't be too many more months away, it's very exciting. It's getting to a very exciting stage. Then, you could also call in while you're in town and come and see us in town. And then once we're up and running, I've got all sorts of ideas. One of my things that I really want to do is have a pizza and games night for our younger generation with sight loss.
Sure.
So they can get together and have some fun. So we'll do that at least once a month on a Friday or Saturday. And then, of course, there'll be all sorts of different groups for other beautiful, important clients that we have. So I can't wait, particularly with the... what's it gone out of my mind? But the social activities.
Absolutely.
Not feeling lonely or knowing that others are in a similar position.
Absolutely, and that's one of the the necessary things for folks to feel some sense of community, and we know that that's been your primary goal. So anybody who can help out in any way, we encourage you to send you an email at
info@visionbermuda.pm.
There you go.
Yes, thank you.
So we'd like to thank Dr. Jake Smith, ophthalmologist, joining us today. Thank you for so carefully explaining all the things we just talked about, and hopefully we've encouraged a few people to take that first step and have an eye exam, and then we can make sure that all the right things happen for them. Thank you for doing the work you do.
I'd like to thank Vision Bermuda for all they do. They've certainly made my job much easier and much more rewarding to do.
Absolutely. So it's a great relationship, and we're looking forward to it continuing and going from strength to strength. So once again, thank you guys for joining us today.
Thank you. Thank you for having us in.
You've been listening to Vision Talk, folks, and you can hear this program on the second Monday of every month right here on Ocean 89 at 6:15. We'd like to thank you for joining us.